I'd like to start the meeting by acknowledging the traditional owners of the land where I'm sitting, and I think most of you are sitting as well, the Wurundjeri people of the Kulin Nation, and pay respects to their elders past, present and emerging, and to any Aboriginal and Torres Strait Islander people in the room with us today. We didn't have a guest speaker today. What I was planning to do was give you a run through of the guide to person-driven care that Nan, you, Elizabeth, and I worked on and presented at the International Dementia Conference, which was a project funded by the Wicking Foundation. The Wicking Trust. So we might have a look at that. I'd love to have a chat to the group about what sort of things you'd like to see next year and whether this time slot still suits. So maybe while I'm talking, have a think about that. Here it is. Share. Okay. Now, please tell me if this is working or not working. All right, can you see the slideshow? Or just my PowerPoint screen? And remember, I can't see any of you now, so.
I think I can see your slide presentation.
All right, let's give it a go. So the guide was written by Nan Yu from My Dementia Companion, myself and Elizabeth Baxter, who was Dementia Services Specialist at VMCH, and also had input from Professor Pay, Hugh Doe, and other co-design participants. The gap that was identified was that there are plenty of clinical guides for clinicians working in the dementia space. There are diagnostic guides, there are clinical guides for care, but what seemed to be missing was a guide for social and community supports for social and community supporters. So case managers, care managers, dementia specialists, CHSP program managers, those type of people. So much of the information is tied up within a person's head if they've been in their organisation a long time. And is not written down anywhere. As soon as information gets written down, often it is out of date and becomes redundant because phone numbers change or projects change or managers change. And there was absolutely no transfer of knowledge from these sort of industry experts to the next people in the role. So, oh gosh, where's the next arrow? No, well, that was even my mouse. Here it is. So, as you know, there are 421,000 Australians living with dementia. Dementia is the second leading cause of death and will probably be the leading cause of death next year. And there are 1.6 million carers caring for those people. People and families are often lost after a diagnosis or after noticing the symptoms. They end up going to a GP who may not refer them on. If they get into the sort of clinical space and get a clinical diagnosis, they're often referred just to one of the major dementia providers and then to nowhere else. So we found that was a huge gap. 70% of those people living with dementia are living in the community and receiving regular community care. And we know that the community care workforce shortage is meaning that staff have less dementia care experience and there is less knowledge transfer. There are plenty of clinical guidelines available to clinicians, but a lack of guidance for the community care workforce, which is why networks like this exist, so that people can share that knowledge. But we thought there was a real need to formalise that. So with the lack of guidance for the community care workforce, people were turning to Google. and you can get 400 billion trillion results in about half a second. But how do you know which of those results are the ones that you should trust? Which of those are local and which of those are someone the middle of America telling you to chew on leaves from trees or something? So we built these guidelines taking into, those are the old aged care standards, obviously, because the new ones had not been released at the time of this project. We decided that, well, we found that staff needed a practical tool to prompt, to guide them in their day-to-day work practically, so that staff are empowered to have the confidence to provide holistic and truly person-centred care. The project was funded by Equity Trustees, the Wicking Trust on behalf of the Sir John Minogue Bequest and the John Saville Eastwood Estate. So the guide will give people practical and day-to-day living well information, not clinical. It's a prompt, a case study, and uses case studies, is easy to use and an easy to use approach that follows a rough journey through dementia. And we know that nobody's journey is the same. It's a combination of a literature review, iterative, and a co-design approach, with not just input from the three of us in the project, but consulting with our own carers, audiences as well. So that's a timeline of the entire project. The little circle there is around iterate and co-design. We're actually a little bit further along than that with interim findings, and it's ready to have further clinical input. And I think Nan's organised for NARI to be the next stage in the in writing this guide or evaluating the guide. So that very complicated diagram is an overview of the entire guide. It takes staff, and it can be any staff. This is not going to be limited to case managers only. This will be freely available to anybody who is advising or wants to advise people living with dementia, and to carers themselves if they would like to have a copy. It goes from noticing the signs and symptoms, getting a diagnosis, what the funded and non-funded services are available, people's emotional needs, understanding goals, needs and preferences, building a support network. There's 100 little light blue circles there. It goes to the early and mid stages, where it starts to talk about the carer needing support in those purple circles, and then in the darker blue, approaches to care, communication, medical needs, and building that capacity, that capability to live well with dementia. And then it goes on for planning for end-of-life care, changes in behaviour and unmet needs, and dying well and residential care at the end. The overview or the journey has been adapted from My Dementia Companion, which you probably all know is Nan New's baby, and his web-based app that is full of information for people living with dementia and their carers. Click, click. So the guideline follows three invented but sort of known case studies. The orange people are Mr. and Mrs. W. They're 78 and married with 2 children, and it follows a very, not normal, but typical Alzheimer's disease progression. The blue man in the middle is Stephen, a 57-year-old divorced man with a teenage son, and he follows a journey of young onset dementia progression. And the yellow lady on the right is Jane, a 78-year-old woman who lives alone. Her wife Doris passed away last year, and this gives the view from someone living alone and from their LGBTQI plus background. I know you can read none of that, but the dark blue section on the left-hand side is notes to prompt and guide anyone using the guide. And then the 3 case studies follow along using their own life stories to I don't know, to bring to life some of those prompts. So what does it mean to contact the community? What does it mean? Does it mean go just having a word to somebody's volunteer job and asking if everyone's wearing a name tag? Does it mean organising a transport service so someone can continue to volunteer in the community? Does it mean giving them the number of not necessarily a clinical organisation, but one of the community services that you know exists in your area? I will say at this point that we've not mentioned in the guide one single phone number or the name of a single organisation. Instead, it refers to your local peak body for dementia, your local LGBTIQ plus health service, your local community centre, your local My Aged Care provider or CHSP provider or whatever, NDIS support coordinator. As soon as we figured, as soon as you start mentioning telephone numbers and names of organisations, they will all change next year for some reason, or they'll be called something different, or their hotline will have a different number. So we very carefully have not referred to a single specific organisation. Where's my mouse? Here it is. So it's landscape for people to pull up on their computer quickly. It's not as easy to use on a phone because we figure we thought most of the people using it would be sitting at a desk doing care management, talking to people on the phone, that sort of thing. The overview for considerations on the left uses case studies. And as a caveat, these case studies are not mutually exclusive. They're there to assist, just to prompt ideas as people are going through that dementia journey. There are some examples there of the guide in action. This one talks about using technology at home. With My Aged Care, you might, if you're calling a traditional pathway, you might get referred to My Aged Care and the GP. With the guide, you could be actually prompted to do that, but as well to use technology to go down to the independent living centre, to have a different phone so that someone can still independently access their phone, and to ways to maintain social connections. So it gives a whole lot of holistic ideas as well as the general. Ring My Aged Care, get a diagnosis, get some services in and get a home care package or an NDIS support plan. Different examples. So the interim findings were that it was easy to use, it was logical, it was practical and related to people's jobs, and it was comprehensive. We co-designed with 17 participants who had between 10 and 18 years experience in home care, disability and community care. Every single one of those people saw the need for the guide, and thought they would use it daily, weekly, or regularly. I know that's a very small amount of co-design participants, which is why it's moving on to the next stage after this. So next steps is working with NARI for some academic input, collaborating with our network, so yourselves and other networks, to continue building this for better care and benefit of the sector. And of course, we will need the network's helps to disseminate the information, to spread it around, to give it to your staff, to take it to your own network meetings. It will not be tied down in any way. You can print it off as a PDF, as a document, have it on your screen as a PDF, or access it online. So that was the guide. Stop sharing, Sarah. And now my Zoom thing's gone on the wrong window. Any questions about that? I can't find my mouse. It's gone. Anyway, I'll just move the camera. Any questions about that?
Hi, Sarah. That looks amazing. Sorry I came in a bit late. I
That's all
just
right.
was interested to see how it ties in with the Forward with Dementia website as well, because that was set up for that first year post-diagnosis, and obviously with the streams for the person, the care partner, and the professionals. But is there a crossover between the two
I think there probably is
resources?
a crossover,
Yeah.
but it can be used as a standalone. And I think, again, Forward with Dementia recommends organisations and telephone numbers, which is great
Yeah. Mm-hmm.
until they change. And I think this guide will have a lot more longevity without a lot more input,
Mm-hmm.
just because it doesn't reference specific organisations.
Mm-hmm.
I can see with the, pardon me, the aged care reforms and councils getting out of care and all the rest of it, there's already been an enormous shift in who's providing what service and what their names are and how you contact them. And hopefully a care manager using the guide would know the local landscape. And if it says ring your local assessment service, you'd know who your local assessment service was. If it said ring your local dementia, peak body or training organisation, you'd know who that was. So it's giving those very broad prompts that will suit every town, every city across Australia. But yeah, look, I think they're both mutually beneficial, and people should probably use both. Any other questions about that guide, which isn't available yet, but as soon as it is, we'll be able to let you all know, and we will be consulting with the network for feedback when it goes to that stage. All good? The other thing I wanted to share with the network was the most recent Young Onset Dementia Summit that was held in Melbourne at the Jasper Hotel a couple of weeks ago. Let me just get rid of that because that's going to confuse me. I don't know whether it's good having 3 screens or bad. Sometimes I have no idea where I am. Let's move that over there. Oh, now I've lost Zoom. There you are. The Young Onset Dementia Summit was born of Elizabeth and my frustration at having so little information to share with people about young onset dementia and the services available. We spoke to Bronwyn Morecambe from the Young People in Nursing Homes Alliance, and she said, "Well, let's do something about it. Let's have a summit," which was fabulous. So it took about 6 months, but Elizabeth and I sat on the planning committee along with Bronwyn and a couple of other people from the Young People in Nursing Homes Alliance, and brought people together for this summit and for some big discussions about lack of services for people with young onset dementia. So can people see that website I'm sharing, Shaping the Future Young Onset Dementia? We had 110 representatives attend. It was attended by people living with young onset dementia, care partners and family members, clinicians, support and service providers, peak bodies, policymakers and advisors. We did try to get Bill Shorten and some of the other parliamentary secretaries and things, but it was a bad week for that apparently, and we just didn't get the traction. Models of care. So we had the models of care and pathways for people with young onset dementia. So we had a report from the Joint Solutions project. So Sam Loy spoke about a rapid review of the models of care. We had the results, the very brief results of the Joint Solutions project from Dr. Claire Beard. And the Joint Solutions project results, which are available now both in full results and in an easy read version. And Professor Amy Brockman talked about updating the dementia clinical practice guidelines and principles of care. And a call to action was then presented, pardon me, that had been written, I suppose, by a group of people who both lived with dementia or had cared for someone with young onset dementia. Vicky Barry spoke from overseas. She's the founder and facilitator of Young Dementia Network. Oh, sorry. No, sorry, that was WA. Tessa Guttridge was the lady from the UK who spoke on young onset dementia UK and the way they formed their network, their advocacy group. We had very moving stories from carers and from people living with dementia. Natalie Ive lives with young onset dementia. She spoke about the lack of support and information for people diagnosed with young onset dementia who were still working, and the lack of support they had to continue with their vocation in any way at all. Carers, if you would like to know more, there's I would hope there's going to be a group formed, a working party, or some form of working group, and you can express your interest to Bronwyn Morecambe at Young People in Nursing Homes for further information. And as you can see, subscribe there. So that was fascinating and long overdue, but a good start, I think, to improving some of the services for people with young onset dementia, particularly in Victoria. Any questions about that one? It's going to be a quick meeting, I can tell.